Welcome to my YouTube channel. Today's video, we shall be appreciating the root of the lungs. We shall be discussing the structures that enters and leave the lung at the lung hilum. So that is all about today's video. It's all about those structures, those compassionate structures that enters and leave the lung at the lung hilum. So if you are coming across my channel at the first time, enable to subscribe, because in this channel we detail every video and give concepts that are comprehensible, that will guide you to pass medical board exam. Now let's proceed. The first thing we shall be noting down is the introduction. Now, what is the root of the lungs? This diagram here depicts the root of the lungs. This is the left root of the lung. This is the right root of the lung. Now, the left and the right. So this is the left root of the lung and the right root of the lung. So the root of the lung is a short, broad pedicle connecting the medial surface of the lungs with the mediastinum. It is a short, broad pedicle connecting the medial surface of the lungs with the mediastinum. So this is the concept of the root of the lungs. It consists of those structures that enters and leave the lung at the lung hilum. That is the root of the lungs. This is a short, broad pedicle that does what? Connecting the medial surface of the lungs with the mediastinum. It consists of those structures that enters and leave the lung at the lung hilum. That is the lung hilum. Now, what is the lung hilum? The lung hilum is an area which is located on the mediastinal surface of the lungs. It's an area that is located on the mediastinal surface of the lungs through which structures enters and leave the lungs. Recall that the root of the lungs is covered by a tubular sheath derived from the mediastinal pleura. By a tubular sheath, the root of the lungs is covered by a tubular sheath that is derived from the mediastinal pleura, right? So that is how it is being fashioned, right? So the hilum of the lungs is an area located on the mediastinal surface of the lungs. It's an area that is found on the mediastinal surface of the lungs, through which structures enters and leave the what? The lungs. That is the concept of the root of the lungs. Now, the next outline is the component of the root of the lungs. Components. We have number one, we have the left principal bronchus. Left principal bronchus. Number two, we have the right epitheria and hypatheria bronchus. Number three component of the root of the lungs is the pulmonary artery. Pulmonary artery. That is the right and left pulmonary artery. Number four is the pulmonary veins. pulmonary veins. Look at the two pulmonary veins, the right and left pulmonary veins. There are two on each side, the pulmonary veins. Number 5 is the bronchial arteries. Bronchial arteries. On the bronchial arteries, we have one on the right and two on the left. One on the right and two on the left. The number 6 component of the root of the lungs is the lymphatics of the lungs. Lymphatics of the lungs. The lymphatics of the lungs. The number 7 is the anterior and posterior pulmonary nerve plexus, or anterior and posterior pulmonary plexus of nerves. Anterior and posterior pulmonary plexus of nerves. So these are the components of the root of the lungs. Now watch here. This is the right root of the lung. This is the left root of the lungs. Now we have our hepatarial bronchus, particularly right hepatarial bronchus. We have our same right hepatarial bronchus. We have our bronchial arteries. You recall that we have two on the left, we have one on the right. Bronchial arteries. We have our these two are the superior pulmonary veins. So the right and left superior pulmonary veins, right and left superior pulmonary veins. We have the right and left inferior pulmonary veins, right and left inferior pulmonary veins. Okay, this is our pulmonary artery. That is the left pulmonary artery. Left pulmonary artery. This is our right pulmonary artery. Pulmonary artery. This remains our left principal bronchus. Left principal bronchus. Recall that it is not everything that is written here are showcased on these diagrams, but they are here, but it is not everything here that is showcased on this diagram. Okay, so these are the components of the root of the lungs. This is how they are being represented. Now you have to understand that there is an extension of the root of the lung called the pulmonary ligament. So this is our pulmonary ligament. the pulmonary ligament. Now, the next thing we shall be discussing is the division of the component of the root of the lung, because there's how it is being divided. There's how the component of the root of the lungs is being divided. Now watch. It is composed of two divisions. That is the root of the lungs. We have from before backward, this is number one, and number two, we have from above downward. So these are the division of the component of the root of the lungs. Now, from before backward, we have components that forms it. From above downward. Now, from before downward, we have three components. Number one is the pulmonary vein that forms it. Pulmonary vein. Number two is the pulmonary artery. Pulmonary artery. Number three is the bronchus. The bronchus. And in that bronchus, it includes the epithelia and hypatheria bronchus. That is what that forms the bronchus. So we have the bronchus. Now it has a mnemonic. Remember it. Mnemonic to remember it is verb, the pulmonary vein, pulmonary artery, and the bronchus. That is the component that forms from before backward of the root of the lungs. Now, from above downward, we have the right and left. On the right, we have number one is the epithelia bronchus. Epithelia bronchus. Number two is epithelia bronchus. Number three is pulmonary artery. Number four is inferior pulmonary vein. So that is how it works. Now recall that this pulmonary vein is particularly the superior, not inferior. So let's indicate it is superior pulmonary vein. Why this is inferior pulmonary vein. Now on the left, we have the pulmonary artery. We have the left principal bronchus. We still have the pulmonary vein, inferior pulmonary vein. So these are how it is being worked. So the left and the right forms from above downward. Now this forms from before backward. Now what we shall be discussing next are the relation of the root of the lungs. Yes, the relation. It has four relations. relation. You have anterior relation, posterior relation, superior relation, and inferior relation. Okay? So, anteriorly, the root of the lungs is related by the phrenic nerve. Is related by the phrenic nerve. That is number one. It's also being related by the anterior pulmonary places of nerve. It's also being related by the superior vena cava, particularly on the right side only. That is what that forms its anterior relation. I repeat, anteriorly, it is being related by the phrenic nerve, the anterior pulmonary nerve places or places of nerve, and the superior vena cava on the right side only. Now, the posterior relation, it is being related by the vagus nerve. It is also being related by the posterior pulmonary places of nerve. It is also being related by the descending thoracic aorta, particularly on the left side only. That is the relation. Now, on the superior relation, it is being related by the arch of azygos vein on the right side only, and also the arch of aorta on the left side only. That is the relation of the root of the lungs on its superior aspect. Now, inferior aspect, it is being related by the pulmonary ligament. The inferior relation of the root of the lungs is formed by the what? Pulmonary ligament. So that is how is fashioned. So we have come to the end of the class. We have discussed the root of the lungs, ranging from its introduction to its relation. My next class, I will be treating the bronchiopulmonary segment, which is BPS. Thank you so much for staying to the end of this class. I appreciate it.